Gabriela Escutia, MPH, and Yuritzy Gonzalez-Pena, MPH, are epidemiologists in the Acute and Communicable Disease Prevention Program and the HIV STI Prevention and Surveillance Program, respectively. Gabriela and Yuritzy work collaboratively across OHA sections to ensure good viral hepatitis, HIV, and STI data are available to policymakers, program developers, and epidemiological and frontline public health staff. These consummate professionals work diligently to increase our understanding of communicable disease outbreaks and patterns to better serve the health of Oregon's diverse communities. Welcome, Gabriela and Yuritzy.
Okay, good afternoon. My name is Gabriela Escutia, and I am the viral hepatitis epidemiologist for the Oregon Health Authority. It is my pleasure to be here today, and thank you for the invitation. Today, I will be presenting with my colleague, Yuritzy Gonzalez. Yuritzy is our STI epidemiologist, and we will be presenting to you on the demographics and risk factors of syphilis cases co-infected with chronic hepatitis C during 2019 to 2024. Next slide, please. Okay, that's a disclaimer for our presentation today. Okay, so chronic hepatitis C is a liver disease caused by the hepatitis C virus, and it usually does not have symptoms. Therefore, getting tested is the only way to know if one has hepatitis C. This virus can cause serious health problems, including liver cancer, cirrhosis, and even death. Treatment is effective, curing about 95% of patients who receive treatment.
Syphilis is a sexually transmitted infection caused by a bacteria called Treponema pallidum. It is recognized as the great imitator because it mimics the symptoms of other diseases. Syphilis progresses by stages, with primary and secondary stages being the most infectious. Pregnant people diagnosed with syphilis and without adequate treatment can transmit the infection to the fetus, leading into a congenital syphilis. And all syphilis, including congenital syphilis, can be prevented with adequate treatment. In this map, I'm showing the primary and secondary syphilis rate per 100,000 population in 2023. The South and the West region in the United States have the highest rate in the nation. Oregon ranks 17th highest in the nation with 19.2 infections per 100,000, which is higher than the national average. You're muted, Gabriela.
Sorry, yeah. In 2023, the rate for chronic hepatitis C in Oregon was 6.7 per 100,000 population, putting Oregon as one of the states with the most elevated rates in the country and one of the highest, with the highest rates in the Pacific Northwest. Both chronic hepatitis C and syphilis are national reportable conditions. Chronic hepatitis C became reportable in Oregon in July of 2005. Information collected from cases reported include laboratory information, demographics, age, race, and ethnicity, and county of residence. Chronic hepatitis C cases in Oregon are not investigated by local health departments, therefore limiting information in risk factors and treatment in these individuals.
Syphilis is reportable and investigated in Oregon since the 1990s, and local disease investigators follow up in all cases of syphilis and collect information in clinical, demographic, behavioral information to better understand the epidemiology and offer treatment and partner services.
Outside the US, there has been some studies that have shown that syphilis and hepatitis C co-infection are common in some groups. In the US, there was a study in Houston that found that syphilis is a relevant indicator of hepatitis C infection. yet limited information exists in demographics and risk factors of this population. This information is needed to guide targeted public health information. The objectives of this analysis were to describe the demographics, risk factors, and other characteristics among syphilis cases co-infected with chronic hepatitis C in Oregon between 2019 and 2024, and identify the percentage of cases diagnosed with syphilis before hepatitis C and vice versa. We define co-infection as a syphilis case infection reported to Oregon surveillance system between 2019 and 2024 with a chronic hepatitis C listed as a comorbidity. We use data from Oregon Electronic Disease Surveillance System. So we first exported the surveillance cases, the syphilis cases reported to us between 2019 and 2024, and there were over 10,000 cases reported during this time frame for syphilis. Of those, about 12% had a chronic hepatitis C comorbidity, including 90 individuals that had more than one syphilis infection during this period. So our final sample for this analysis was 1,297 cases. Our analysis consisted of univariate analysis, bivariate analysis, is basically exploring the demographics and risk factors in these three groups. Overall, the number of syphilis cases diagnosed within the same year with hepatitis C and syphilis has been stable since 2019. The average number has been about 46 cases per year. And those can be seen circled here on red on the slide.
Sorry, I had a hard time unmuting. So one of the questions we had was when each disease was reported in respect to their comorbidities, just looking into the time frame of 2019 to 2024. So we look into the report days of each disease, and we identify that most of the people at the time of the syphilis infection in that time frame had a chronic hep C reported, followed by the group of syphilis cases diagnosed before chronic hep C, and the smallest group was the group that were co-diagnosed at the same time, which included plus or minus 30 days from the comorbidity. So this raised the questions if hep C were investigated at a local jurisdiction, could syphilis cases be prevented?
Unmuted again, sorry. Okay, so this graph shows the distribution of cases by type of disease and the age at time of diagnosis. So those on purple are syphilis, the green ones are chronic hepatitis C cases. And so over 50% of chronic hep C cases were diagnosed before the age of 40, while syphilis cases at the time of syphilis diagnosis were older. Here we show the distribution of cases by sex and race and ethnicity. The majority of syphilis cases co-infected with hepatitis C were classified as white, Black, and Latino males. When compared to the overall Oregon population, syphilis cases co-infected with chronic hepatitis C were more likely to be American Indian, Alaska Native, or Black. The difference can be seen on the right side, and those two groups are circled in red. We took a close look at females by age and disease at the time of diagnosis. The mean age for females was 33 years at the time of diagnosis for chronic hepatitis C and 37 years of age at the time of syphilis diagnosis. To compare means between these two groups, we conducted a t-test, and it was determined that the means were statistically significant between these two groups. Overall, females were diagnosed with chronic hepatitis C at a younger age in this group, at least for this analysis. And when looking at the percentage, you can see on the graph on the left, 84% of females were in the group of childbearing age at the time of diagnosis of hepatitis C, and 75% of females were in the same group when diagnosed with syphilis. Because most cases, as Yuritzy mentioned at the beginning on slide 12, most of them were diagnosed with chronic hepatitis C, at least for this time frame. Before syphilis, we investigated the mean time in years between the two diagnoses by age, and we found that the younger one is at the time, or in that group of younger, the time is at the chronic hepatitis C diagnosis, the longer it takes for a syphilis diagnosis. The mean time between diagnoses for those under the age of 30 at the time of chronic hepatitis C diagnosis was over 6 years. This can be visually seen on the graph on the right. So here it is important to point out that some individuals in these groups had syphilis infections before hepatitis C, so maybe even before 2005, before hepatitis C became reportable in Oregon. And this is true for the time frame the time frame only represents syphilis infections between 2019 and 2024.
So we also wanted to look into where were these conditions being reported. And so we wanted to look into the geographical distribution, and our first step was to see if these conditions came from the same county. And it was surprising to find out that 69% of the sample had their hepatitis C and the syphilis infection from 2019 to 2024 reported from the same jurisdiction, even though there's that time gap that Gabriela mentioned before between the report dates. So we look into the risk factors of syphilis cases diagnosed in 2019 to 2024 by geographical area for syphilis. And the geographical area are defined at the county level based on the definition of Office of Rural Health. So we identified on the left column, we have the risk factors that we gather at the time of a syphilis case investigation. And then across, we have the different geographical areas. The injection drug use, we identify that there's evidence to suggest that the distribution of almost all risk factors vary across regions. And the highest percent among those who reported injection drug use was highest in counties that are identified as rural and urban counties. Non-injection drug use was highest in rural counties, male with male partners in urban counties, sex while intoxicated in rural urban counties, incarceration history among frontier counties, the use of applications to find sex partners in urban counties. Some of these findings represent the distribution of Oregon's population, with most males who have sex male partners living in urban areas, and also people in urban areas having a better access to phone service to find sex partners through application. So it's not the injection drug use, it's a behavior that it's identifying both conditions for syphilis and hepatitis C. So we wanted to look closer just into the proportions of injection drug use among this sample data. And among those who answered, the risk factors, 53% reported using injection drug use in the last 12 months from their syphilis report. And not everyone is willing to provide that information or able to reach by the local health departments. And so we had a little bit over 500 people with missing or unknown information about drug use. Limitations. There are quite a few limitations in this study. First, it's surveillance data. And so it doesn't represent the population of Oregon and also people who might be infected with syphilis or chronic hep C and have not received care to be diagnosed with one of those conditions. The risk factors are collected at the time of the syphilis diagnosis, and it doesn't mean that that person had that behavior at the time of their hepatitis C. We also using the syphilis infection from 2019 to 2024, it might not be the first syphilis infection ever. Discussion.
Okay, so conclusion. Overall, the number of syphilis cases co-infected with chronic hepatitis C, that's in year, have stayed the same since 2019. Syphilis cases are co-infected with chronic hepatitis C are diagnosed with chronic hep C infection at a younger age compared with syphilis diagnosis. Syphilis cases co-infected with chronic hepatitis C were more likely to be American Indian, Alaska Native, and Black when compared to the overall Oregon population, and over 70% of female were of childbearing age at the time of diagnosis, and this was true for both syphilis and chronic hep C. Most syphilis cases co-infected with chronic hepatitis C were diagnosed with chronic hep C before syphilis. And the mean time between those two diagnoses by age group shows that the younger one is, the longer it takes to be diagnosed with syphilis. This is an observation. Enhanced testing for hepatitis C infection when conducting syphilis testing and vice versa is recommended to identify populations at need of public health interventions, and continuous outreach and education is suggested for young adult males, American Indian, Alaska Native, African American, and females of childbearing age in Oregon. We thank you for your time. I would like to acknowledge all the local county health departments, disease investigators, because without their work, we wouldn't have this data. And thank you, Yuritzy, for this collaboration. We don't investigate hepatitis C cases in Oregon, chronic ones. We only investigate the acute ones. And so having those risk factors there, even though we know that we don't know if it's true, if they were having those behaviors, during the time of diagnosis of chronic hep C, it gives us a good idea of what's going on in this population. Thank you for your time. We welcome any questions right now.